Sulochana Karomi, a dentist, and I'm here today with another episode of Tooth Talk Thursday. Hope you guys are having a wonderful Thursday, and we are coming live from our office. We're located over at 8710 Northern Boulevard, Suite 204, Jackson Heights, New York. The topic today is third molar, and so let's talk a little bit about third molar, or generally teeth. So what happens is, like, we have we all are born with no teeth, but we all have those, like, the mineral particle of the teeth erupting, or in their phases, different phases of mineralization in the mouth when we are born. So third molar, so the 20 teeth are deciduous teeth. They are like primary teeth, or we also call them baby teeth. As you grow older, those teeth are replaced by another set of, or complement of, permanent teeth, also called as succedaneous teeth. So eventually, there are 32 teeth present in the mouth, or altogether there are 32 adult human teeth. Some may be born with like less teeth, or some may be born with like more extra teeth, which are called supernumerary teeth, right? So just a little idea about teeth or their development. So what happens is third molar, it is formed in the mouth. It's called initial mineralization around age about age 8.5 to 8.5 basically, and then slowly it gradually matures into a full teeth. The crown formation is completed around like age 14 to 15 years, and then around 22 years, like, complete root formation takes place, and it's eventually in the mouth with a complete root. So that's a little bit about the teeth eruption, the third molars, also known as wisdom teeth, right? So the other important thing is, so these numbers are just for like an average. So every individual teeth, it varies, like for every individual. So why is it important to monitor those third molar or get them evaluated? So what happens is, since the third molar is the last tooth to erupt in the mouth, so sometimes there may be a little imbalance in the jaw size, or tooth size discrepancy, and you may not have enough room at the back of the the jaw. So there may be, the tooth may have difficulty erupting completely. It may be partially erupted but may never erupt, or sometimes they may be angled like to the forward, to the front, to the back, or sometimes upside down. So they're present in various forms. So that is where it is important to monitor them, and throughout the phases of various development. So I would say it's a good idea to take like a bigger X-ray, what is called a panoramic X-ray, when they're about like mixed dentition, around 12 to 14 years of age, just to make sure those teeth are there, or no pathology is going on. And then after all the teeth are formed, it's a good idea to take another panoramic X-ray just to make sure they are their developmental path is normal, and then in conjunction with the radiographic evaluation, we also do the clinical evaluation as well, just to make sure the teeth are on track, or the progression is going pretty well. We also make sure there's no any bone loss, or it's not hitting those front teeth. Sometimes those are like areas of where you can trap a lot of plaque, and eventually it may at the verge of catching caries, which it just goes unnoticed, and eventually end up losing those teeth. So that's another important indication to monitor those teeth. The third is, and it's very important because these teeth, sometimes if they're impacted, that's in the bone under the gums. What happens is, if they are if they're there for a long time, and if you do not monitor them, sometimes they develop cysts around them, so which is it's a significant pathology. So that's where it's very important to monitor those third molars. if they are completely in the gums or the bones, just to make sure you don't develop any cyst or any swelling around the jaw or the jaw, the top and the bottom. So those are the important factors. So hygiene. So what happens is if those teeth are not completely erupted, but they're still, there's opening around the gums, it may be, like an opening creates, let's say it this way. So if those barrier, the gingival, like the gums not covering it, so it can, the bacteria or any microorganisms can seep through those gums or those opening and may cause infection. I'm not sure if you guys have noticed, or because I've had that on myself too. So sometimes they develop pericoronitis, that is inflammation or swelling around the gums that is covering the third molar. So if they are untreated, or if the infection flares under the gums into the bone, so there may be some kind of infection, like space infection, that could be another detrimental situation where a lot of antibiotic or heavy dose of antibiotic is maybe indicated. And sometimes, if they develop those big swelling abscesses, that's another important situation too, where you may end up, so that may be another important situation where it may be life-threatening at times too. So yeah, those are some of the important factors to consider. So consider to and in the evaluation of third molars. So that is where it is very important for all of you guys, with third molars, just to make sure they are stable, get an evaluation done. So it can be done at your general dentist. If it is not, it is something that we cannot do any kind of therapy or treatment, it can be indicated to a higher, like a specialist, or sometimes it can be worked at a hospital setting too, under general or local anesthesia or sedation. And so I get a lot of questions about when is a good time to get a third molar extracted, or do you really need to get them extracted? So those are common questions and very important questions to consider, or to ask your dentist, because what happens is, like I mentioned earlier, it develops around the age, around 14 to 15 years of age, the crown is fully formed, and the root starts forming after that. So 16 to 22, 23 is a best age to get an evaluation done, just to make sure those roots are not developing close to the nerve, or if they're close to the nerve too. So those are very important, indications to get an evaluation done as well. So 18 to, like I said, 16 to 22 is a best age to get an evaluation, and if needed extraction, you can always get them out around that age, because when you're young, the young bone or has a lot of what is vascularity. That means there is a good healing potential, a good bone formation. So if those teeth are taken out during that time, that's the best age for the bone or the gum tissue to heal. That doesn't mean that you cannot get extraction later in life, right? So again, sometimes I would monitor them when those roots are very close to the nerve. We may end up evaluating using a 3D imaging called CBCT to see the proximity of the roots to the nerve, or how close they are to the nerve, in simple words. So what it does is, if we extract those teeth, they're close to the nerve, sometimes the nerve may rip apart, or if it's touched, there are chances you may develop some kind of neurological condition, or some example like paresthesia, where the numbness, you may end up having that numbness for a long time, or you may not feel the jaw for some time. So, those are paresthesias, or those are certain conditions that may develop as a consequence of not diagnosing those, like the roots to the nerve proximity. So that's where diagnosis comes very handy, and it's very important to diagnose that as well. The other thing is, I know I was about to talk to you guys about, yes. So sometimes when they are close to the nerve, but again, you develop those pathology on top of the teeth. For example, like some deep pockets. Hi, Sergi, how are you? Yes, thanks for joining in. So yes, yeah. So if you have those pockets on the back end of of your second last molar, it's like it's a prone area. It's highly prone to getting all those debris, bacteria or microorganisms into this pocket and eventually developing infection. So I do like a grading system of, if you have a deep pocket more than about like 5 millimeters or so, I would suggest you get an evaluation, or just to make sure they're stable. If they are deeper than that and you're losing a lot of bone at the back end of it, I would eventually, and then like you cannot get extraction because you have those roots are close to the nerve. So I would consider something called coronectomy, where you just cut like a part of the top of the crown, the top of the tooth, and then fill with some bone grafting. So that's another it's a little complex procedure when you hear it, but it's not. It's a great solution to situations where nothing works, or like you need extraction but you're close to the nerves, you don't want to develop that harm or cause any damage to your nerves. So that is something to consider as well. And again, these are like specialized procedure, and we can always plan that, or plan that and treat as per individual's need and by proper complete diagnosis and planning. So yes, and on that note, if you guys have any question, I can answer them for you. Thanks guys for tuning in, and it's so good to see you all. I know this November is a month of gratitude, and I'm so thankful to be here, amid all this chaos that's going on. So yes, again, so stay safe everyone, and hope to see you guys soon. And I have some announcements to be, some announcement that's coming, and I can't wait to share that with you guys. So stay tuned and have a wonderful night. Bye bye.